Hi viewers, today we'll see care of patient with cardiotonic inotropic drugs. I am Dr. Kaliselvi Xavier, Professor, Tribhulam College of Nursing. Objectives of today's class. At the end of the class, the students will be able to know the introduction of cardiotonic inotropic drugs, describe the cardiac glycosides and phosphodiesterase inhibitors of cardiotonic inotropic drugs, enumerate the therapeutic action of cardiotonic inotropic drugs, enlist the indications of cardiotonic inotropic drugs, mention the pharmacokinetics of cardiotonic inotropic drugs, enlist the contraindications and cautions of inotropic drugs, specify the adverse effects of cardiotonic inotropic drugs, explain the interactions of cardiotonic inotropic drugs, and describe the nursing consideration of inotropic drugs. What is cardiotonic inotropic drugs? It is particularly useful for patients with heart failure wherein the heart is not able to effectively pump the blood towards different body parts of the organs. As a result, cells of the body are deprived of oxygen and nutrients. Now we'll see cardioglycosides. Cardiac glycosides are cardiotonic agents from foxglove or digitalis plants. They exert their effects on the cardiac muscles by affecting the levels of intracellular calcium. With in turn, the contractility of muscles is increased. What is the therapeutic action when you are using this drug? This drug allows more calcium to enter during contraction, thereby increasing the force of contraction. Here the positive inotropic effects happened. So consequently there is increased cardiac output and renal perfusion, which will increase the good blood supply to the kidney, decreases the renin release. This downplays the activity of renin angiotensin aldosterone system, which causes more fluid to be excreted in the body through urine, which decrease in the blood volume is that workload of the heart. So another mechanism this drug is to be increased the workload of the heart and slow down the relaxation of the cells. Thereby this drug can increase the strength of contractility without increasing the rate of contraction. What are the indications? Here the primarily indicated for decreasing workload of the heart and releasing heart failure. Digoxin is especially indicated for atrial flutter, atrial fibrillation and paroxysmal atrial tachycardia. Where the indication for the children's, it can be widely used in the treatment of heart defects in children's, but margin of the safety for the drug dosage is small. So here the nurse should recalculate and revalidate the dose with another nurse before administration. Serum level of digoxin and signs of digitalis toxicity should be monitored carefully. For the indication for the adults who are all to be taken in adult, the age group should be educated on manifestations that should be reported signifying drug toxicity. The adults are cautioned against utilization of the different bands of digoxin, as differences in bioavailability can increase the chance of toxicity. It is important for these patients to be taught how to take their own heart rate and assess its irregularity. Safety of this drug for pregnant women is not established. As for lactating women, although digoxin enters the breast milk, it has not been associated with the adverse effects in neonates, but caution is still exercised. Indications older adults are more susceptibility to drug toxicity because of the drug-lying condition that would interfere with the metabolism and excretion of the drug. Renal and hepatic functions should always be monitored. Relatives should be instructed on how to take heart rate and assess its regularity. Careful attention should be given to another drugs taken by older adults, patients, as well as their alternative therapies. This is a pharmacokinetics or is a durations, and also the peak and onset is the oral 30 to 120 minutes, the IV is 5 to 30 minutes, the metabolism not available, the excretion is happened through urine. The contraindications, allergy to any components of the digitalis preparation, we have to prevent severe hypersensitivity reactions, and also we should not given for the condition with ventricular tachycardia and fibrillations because of the fatal arrhythmias, and heart block can be worsened by drug effects through AV node. Idiopathic hypertrophic subaortic stenosis is also obstruction of the outflow tract to the aorta can result for increasing the force of contraction. This can be lead to severe problems. Other conditions for the contraindications, acute myocardial infections, force of contractions can damage the muscle, heart muscles, renal insufficiency, drug is excreted through urine and existing renal insufficiencies also drug toxicity, pregnancy and lactation also can be avoided. Adverse effects, CNS, headache, weakness, drowsiness, vision changes can be happen, and the severe arrhythmias, GI upset, anorexia. The nursing alert signs and symptoms of digitalis toxicity, anorexia, nausea, vomiting, malaise, depression, irregular heart rhythms should be informed immediately. What are the interaction? Digoxin immune, Fab or digifab antidote. These antibodies bind molecules of the digoxins, making them unavailable at site of action. Used when serum digoxin is more than 10 mg per ml and serum potassium is more than 5 ml equal per liter. Verapamil, amiodarone, quinine, erythromycin, tetracycline, cyclosporine increase therapeutic and toxic effects of the digoxin. Combination of the digoxins with any of these drugs warrant decrease in dose of digoxin to prevent toxicity. Potassium lowering diuretics also increase the risk of cardiac arrests. And also thyroid hormones, metoclopramide, penicillins, decreased therapeutic efforts of digoxins, and cholecystoramine, charcoal, cholesterol, antacid, fluomycin, cyclophosphamide, methotrexate, decreased absorption of digoxins also to be taken care of for 2 to 4 hours. We have to remember the decreased therapeutic effort of digoxin, and also we have to remember the increased risk of digoxin toxicity by help of the Jones-Watt xylene mechanism, and also Zinn-Havthorne mechanism can be used. What are the nursing consideration as nursing assessment? These are the important things the nurse should be aware of: the history collection and physical examination. The nurse should assess for the contraindications, renal insufficiency, MI and hypersensitivity actions, and the before should administer the drug therapy should note down the therapeutic side effect of the drugs, and should assess the weight and fluid status of the patients, and also closely assess the patient heart rate and BP before administering the digoxin. Auscultate the heart sounds, abnormal sounds, and to monitor the urinary output, the nurse must be observed the ECG and renal functions before administering the drug. And the nursing diagnosis: decreased cardiac output related to insufficiency, myocardial contractility, and also to frame ineffective tissue perfusion related to decreased blood flow to different parts of the body, and also potentially should frame the nursing diagnosis risk for fluid volume deficit related to increased renal perfusion as effects of the drug. And here the implementation with rational. These are vital nursing interventions done in patients who are taking cardiac glycosides, and also the preparation carefully to avoid medication errors. and also to administer the drug with the food and antacid to prevent a decrease in drug absorption. Important to be noted, 1 full minute before administering drug to monitor the adverse effects of the, we have to assess pulse. The drug is withheld if the pulse is less than 60 beats per minute. Apical pulse is taken after 1 hour, or if it is remains low, nurse should document immediately inform to the doctor. Nurse should also assess the pulse rate and detect the dysarrhythmias and arrhythmias after given the drugs to the patient to assess the drug toxicity. Weigh the patients and to depends upon the patient's level of the condition, pitting edema or edema, severity of the fluid retention to be assessed, and the nurse should be assessed the monitor the serum digoxin level as ordered to evaluate the therapeutic dosing and provide comfort measures, provide frequent meals for GI upset, instituting the safety measures for drowsiness and weakness, providing adequate room lighting for the visual distresses. Promote bed rest relaxation technique to balance supply demand of the oxygen. Ensure maintenance of the emergency drugs to equipment of the bed. To assess for the arrhythmias, penitent for the seizure, atropine in case of the clinical significance of the low heart rate and cardiac monitor, and also to promote in case of the severe toxicity assessment to be done. Educate patients on drug therapy, include drug name, indications, adverse effects, and assess according to the patient's condition, monitor for the other side effects, and understand about the patient's condition to explain the indication side effects to monitor for the compliance of the drug therapy. Next drugs we will see phosphodiesterase inhibitors. Phosphodiesterase inhibitors aid in increasing force of myocardial contractility through their enzyme blocking effect. This in turn increases the flow of calcium into the myocardial cell. What are the therapeutic action of using this drug, which will increase the by blocking the enzyme phosphodiesterase cyclic adenosine monophosphatase, which increases CAMP stimulates flow of calcium towards the myocardium and thereby increase the force of cardiac contractility, which will increase the intracellular calcium and prolongs effects of the sympathetic stimulations. This will lead to 3 major effects. One is vasodilatation, two is increased oxygen consumption and also arrhythmias. Indications: only indicator for short-term treatment of patients not responding to cardiac glycosides, vasodilators and diuretics. Drug use is only limited to severe situation because it is associated with fatal ventricular arrhythmias. Children can be used, but a drug is not recommended for this age group. Indications: adults this age group should be educated on manifestation that should be reported significant drug side effects. The important for these patients to be taught how to take care of their own heart rate and assess irregularity. Pregnant women, safety of the pregnant infant, the drug usage pregnant lactating women is not established. Older adults are more susceptible to drug toxicity because of the underlying condition that would interfere with the metabolism and excretion of the drug. Renal and hepatic function should always to be monitored. Careful attention should be taken with the other drugs. This is a pharmacokinetics. The duration peak and the onset is immediate 10 minutes. It will be interact with the liver and excretion through urine and fecal. Contraindications: allergy to phosphodiesterase inhibitors bisulfites prevent severe hypersensitivity reactions, severe aortic or pulmonary valvular disease, acute MI, and also the condition with the fluid volume deficit. It should not be. Adverse effects: CV, ventricular arrhythmias, ventricular fibrillation, hypertension, chest pain can be happen, GI nausea, vomiting, GI upset and abdominal pain, hematomatosis, thrombocytopenia happen, associated hypersensitivity reaction, vascularitis, pericarditis, pleuritis and ascites, burning and intravenous injection site. Interaction: the solutions together with furosemide and precipitate patients. Nursing consideration, before to do administer this drug, nurse should assess the history collection and physical examination, assess for the contraindication and side effect of the drug, explain the drug regularly to the patient, and identify the any drug therapy to identify the any side effect from the patients, and assess the weight and status of the patients. Before to administer, the nurse should assess the heart rate and blood pressure, urine output, ECG, and blood complete blood count, and serum electrolytes, and renal and hepatic functions to be asked. And the nursing diagnosis to be framed: decreased cardiac output related to insufficient myocardial contractility and hypertension, and also ineffective tissue perfusion related to decreased blood flow to different parts of the body, and the potential diagnosis: risk for fluid volume deficit related to increased renal perfusion as effect of the drug, and also risk of injury related to EC bruising 20 thrombocytopenia. Implementation: the nurse should assess for the vital signs, and nurse should assess for the dehydration level of the patients. The nurse should assess and provide the IV fluid to promote safe administration of the drug. To assess, nurse should assess the weight, and to progressively assessment should be done for the patient for intake and output. Skin assessment to be monitored, petechiae, any changes in the skin, the spot, red light spot which is present in the skin, we immediately to inform to the physician. Bruising and bleeding to assess presence of the thrombocytopenia. Monitor intravenous injection site to promote prompt intravenous in cases of burning sensation and irritants. Other comfort devices, GA upset, instituting safety measures, drowsiness, weakness, adequate room lighting, visual disturbance to be assessed, educate the patient drug therapy and indication, contraindication, other side effect of the drug to be to the patients. Evaluate, here aspects of to be evaluate, determine the effectiveness of drug therapy. We should assess the side effect, clinical manifestation of the heart failure, and to be assess arrhythmias, thrombocytopenia, and evaluate the drug therapy, asking patient the name of the drug, indication and side effects, and also monitor the patient compliance up to drug therapy. These are all the reference. Thank you for patient listening.